My name is Dr. Gigi El-Bayoumi, and I'm the founding director of the Rodham Institute. This is DC Reimagined.
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 We're partnering with the Rodham Institute
to improve the health
and well-being of DC.
For me, I'd reimagine DC as being a city where no matter where you went, everyone in DC had access to the exact same healthcare, food opportunities, and working with the team at the Rodham Institute to develop ideas and especially to bring forward the Mobile Clinic Initiative. The Mobile Clinic Initiative is an initiative where we use these 2 mobile units that United Medical Center has. It's basically, imagine a primary care clinic on wheels. It looks just like if you walked into your doctor's office. There is a registrar, there's a little area where you can get your blood drawn, and there's also a room where a physician sees you, takes notes, and just the same thing you would see with the exam table, the whole 9 yards. One of the big issues that I discovered in Ward 7 and 8 is that there are very little grocery stores. When any one of us that lives in any other community, you can name 4 grocery stores within like driving distance of your house. And in Ward 7 and 8, there are only 2 grocery stores for an entire community of 80,000 people, which is appalling when you think about that we are 2 miles from the Capitol. And so our vision for this food pantry was the idea that you could go to your primary care physician. They would ask you questions to determine whether you were food insecure. Food insecure meaning that you didn't have access to food or were worried about where you would get your next meal. And we could write you a prescription. You would take that downstairs to the food pantry of the hospital or the food pharmacy, and you would get enough food for 2 to 3 weeks, and we would connect you with other resources that would help you get food for the rest of the month. I think the Rodham Institute United Medical Center partnership is very unique because I don't think there's very many healthcare systems in the country that are doing something like this, looking at the social determinants of health and using that as the way that you address healthcare for the people in the community that you serve. I think it's innovative and new, and to be honest, it's the wave of healthcare of the future and the way it should be. My name is Pearlie Itikathra. I'm the GW Medical Faculty Associate Site Director at United Medical Center. We're partnering with the Rodham Institute to improve the health and well-being of DC.
By supporting the Rodham Institute, you'll be supporting the mobile clinics to bring health services to the East End. Our workforce initiative, we're partnering with UDC to increase the number of people that are going into the healthcare field. Support our programs to make a difference in the health and well-being of Washington, D.C.
Please support the Rodham Institute so we can make these programs happen.